another thing that Sam mentioned while she was going through her list of reds is vitamin B6 or vitamin B. I know there's a whole array of vitamin Bs, B6, B1, B2, B12. Um, so what are the benefits of having vitamin B6 or vitamin B in general?
I'll take it. Yeah, so B6, it's really important for your brain development and for just keeping your nervous system and your immune system healthy. So like Mike was saying, with your nervous system comes with, if your nervous system's not regulated, that can lead to anxiety. And so these are just having a regulated nervous system is what allows your body to function in a way that your body is able to respond to stressful situations in a more regulated way. If you B6, most commonly, it is interesting when people do have anxiety. B6 is a really great supplement to look and explore to see if they are deficient in. And then that is a really great natural way to support your body and support your anxiety, as opposed to maybe straight going to something that's prescribed and that's not natural. As a holistic health coach, that is always my goal, is to explore the natural ways that we can help support where we feel like we need that extra support through naturally occurring foods, supplements. So that's a little bit on why it's so important to have B6, but all of the vitamins in general, or all the B vitamins, are really important, as they do really support our energy, and which helps us function properly.
So B6 and cyanocobalamin is vitamin B12. So they need heavy supplementation of these things. So what we say, again the same story. Eat vegetables. But they supplement B6, B6 and B12. And in severe cases, we administer injection.
Right.
B6 also, there is an injection available. So
yeah, well, when people are super dehydrated, or they exist now if you're hungover, which means you're dehydrated, you can take these B6. You can get these injections, or you can go somewhere and have it done for you. But I just also want to really highlight how you mentioned there's a reason why these are called supplements and not a substitute, because it means it's supplementing our diet. It's not substituting our diet. So you're not going to take a vitamin C supplement and think that you're good to go. Like, that's meant to be used in addition to everything else that you're eating that day. And
yes,
I
think that's part of the reason also people don't take it very seriously. Let's say if it were to show up let's say like a medicine, let's say you take a Tylenol and they feel better right away, right? People use it more often because they feel
it's a quick fix
right away.
Yeah.
But somehow these vitamins, minerals, and all these things doesn't show impact right away.
Right.
But let's say if a person doesn't have a healthy habit for 20 years, right? It's not a switch on, switch off, but you can see the quality of well-being, over the period of time.
Right. Well, also those people get sick more easily. So it's like preventative versus.
True, exactly. So in other words, let's say you can easily say, we see a lot of people every day, right? So I can easily say, hey, these have this guy has a good quality of life, just by looking at the way they walk, just by looking at the way they talk, they're, you just see some people and say, hey, you don't look your age.
Right. Well, that's also the skin component. Like,
So it's the magic of well-being. Taking care of yourself. So that's all we are preaching for right now. So
that's actually very interesting. Magic of well-being.
Yeah,
that's a nice set of words. So I actually have a story here. My mother-in-law she was visiting us, and one night you know, she came out. She was, not. She was kind of in a state where she was about to cry, and I was walking by, and I'm like, "What happened?" She's like, "I've been struggling with these cramping around my calves and in my legs, and it's been there for a long time." And I asked her, "So did you see the doctor?" And she said, "Yes, we did." And said the doctor said that you have vitamin B deficiency,
Wow.
because of which your nerves are starting to slowly die around your peripheral parts of the body. So they said you need to start taking vitamin B supplements, especially vitamin B12 and B6. And I actually then went and got her some supplement which is loaded with vitamin B12. And within 3 days, she started feeling the effect.
Yeah.
She's like, my cramping has almost gone away, or there's almost no cramping. So it is very, very important that we take complete nutrition, because you don't know how it will impact. We focus too much on diabetes, chronic conditions, pain, but taking wholesome nutrition will benefit you in long run, especially as you age.
Also, let's say we tend to eat repeatedly the same type of food, what is available on the shelves, and so what happens if we do not incorporate fruit and veggies into the diet? Whatever we eat, we consume from the restaurants and from the processed food aisles and stuff, they completely miss the vital ingredients of naturally available, and it is not naturally available. They're required for the body. They are required for the body, and we miss it completely. And if we do it for continuously for a couple of months, or your body starts showing the symptoms. So I mean, I think we were traveling, and sometimes we tend to lose our rhythm in what we eat. So one time I told my wife, hey, I don't know why I'm craving for too much Gatorade these days. And we went, we retrospectively, we going back and see what we are eating and what we're doing. So that means the mineral deficiency. So your body craves. Your body tells you. Your body tells you, hey. Some people, they ask, right, when you go to a restaurant, and hey, what do you feel like eating? What do you feel like drinking? Right. So it's something, So probably they know what this guy is going through when we tell, hey, I want to feel like eating fish with these type of vegetables, right? So probably if that guy is smart, that guy should know what I've been eating last 1 month.
Right.
So that's how this mood works.
Yes. Yeah.
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 Basically, your body tells you.
Yeah. That's what your body. That's what the studies show too.
Yeah, your body's always telling you what it
Body tells you. Your body tells you, but we need to be be smart enough to understand the coding.
Yeah.
Okay.
Yeah.
Very, very interesting.
Yeah.
Awesome.
So like we are discussing about pyridoxine. Pyridoxine is like we discussed immunity, B6, right? So immunity and
Energy.
mood and everything. Also, it has an important role in depression. These days, we need to address this. I want to take some time of our discussion to address this issue of mental health. So basically, pyridoxine, especially B6 and overall B vitamins help in bringing the mood up. So bringing the people from depression out of depression. So I request everybody to start looking into these things and start looking into your diets. To consume more foods that has vitamin B, especially B6, and also you should if anybody start feeling symptoms of it, the easiest way without a prescription, without talking to anybody, is you can just recommend, just go buy some vitamin B supplements and talk to them about the mood. Hey, start taking this twice a day. Drink more water and incorporate more veggies and foods that has more vitamin B's. And talk about going out and taking a stroll outside and expose themselves to outside temperature. So that is itself is a big help for them before they get into deep hole rabbit hole. Anybody especially these things, talking to them, giving them more resources, more supplements that are improves their mood, and getting out of the depression, for people, for their overall well-being of mental health. Probably we can prevent a lot of stuff, what's going on outside. So I mean, it is just a recommendation. I wanted to talk about it because it is, as a healthcare professional, it is our responsibility to talk about it.